Hello and welcome. My name is Dr. Stephen Priest and I'm based at the School of Health and Society in the University of Salford. This lecture today is titled Introduction and the Two Competing Paradigms in Health and Society Research and is the first lecture in an online research methods module. So I'll just start by giving you an overview of the session. The first few slides will focus on the nature of knowledge research and why we need to understand research. Then we'll move on to the research process, after which we'll discuss the qualitative and the quantitative approaches to research. Towards the end of the lecture, we'll talk about where ideas originate, and then we'll run through some example research scenarios. So it's a fundamental part of human nature to ask the question why. Why do some people suffer with certain diseases? How can we improve well-being across society? We use the scientific method to answer these questions and to make discoveries, and we use it in such a way to create a coherent framework to explain the world around us, and importantly, to be able to make predictions. Now, when we're talking about research in health and society or research in social care, we focused at the level of the person. Now, if we contrast that with your sort of stereotypical scientist who works in a laboratory with test tubes and might be working at a cellular level or a micro level, would refer to that research as basic science, whereas our research in health and social care is called applied research because it's done at the level of a person or a society and ultimately should have some real world impact relatively quickly. So if you're listening to this lecture, you're either enrolled on a master's program, an undergraduate program, or a PhD program, or you're just interested in learning more about research. So what will research skills give you? Firstly, they'll give you the skills to systematically build knowledge and understand how you can test treatment efficacy for potentially a new treatment. They'll also allow you to understand how research is used to impact on health policy and service delivery. You might get an understanding of how you could get more involved in research activities, either as a participant or as someone who runs a research project. Importantly, for people that work in health or social care, an understanding of research might enhance your understanding of day-to-day practice and why you've been given certain treatment guidelines. You can also become a critical consumer of research literature and start to become critical potentially about certain research projects which have informed the current practice in your profession. So there's a whole range of different types of ways that we acquire knowledge. And trying to understand and differentiate between different sources of knowledge is particularly important in this day and age when the internet is so prevalent. There's so much information which is on social media and on different web pages, which actually in many cases is just a single person's opinion. So we tend to divide knowledge into two types. One is informal knowledge, which might come from people in authority, from hearsay, from past experiences, or some beliefs or intuition that we have as an individual. Now, that's contrasted with research knowledge. Research knowledge is knowledge which has come around because of some systematic thought process and methodological investigation, which has been analysed and specific conclusions drawn. And importantly, that process has been validated by other people. So we spoke in the last slide about the scientific method or scientific knowledge being based on a very systematic thought process. And it's useful to think of three different characteristics of this thought process in the context of research in health and society. So firstly, that process must be logical. It must involve a set of reasoning methods that have very specific ways of thinking. So for example, we use the term inductive reasoning to talk about the process where we move from a specific observation to a broad generalization, whereas deductive reasoning is the other way around. We move from a broad generalization to a very specific idea. Now, There's more information provided on this in the interactive learning materials for this session. The second characteristic is that the thought process must be understandable. It must follow a logic which can be followed by others and leads to a definite conclusion that can be validated by other people. The final characteristic of research, I think is important to think about, is that it should be useful. It should produce knowledge which can inform professional practice or improve health outcomes or lead to some other research which itself could then ultimately lead to some benefit in health or society. So when we're talking about research, it's useful to think about the stages that we go through when we carry out a research project. And this will help you to understand the process people have been through when you read scientific research papers. So the first step is to identify a philosophical foundation and to frame your research problem. And by a philosophical foundation, that normally refers to the idea of either a quantitative or a qualitative approach to research. The next thing to do is to understand the knowledge out there already. What's the theory base? What research has already been done in this area? What's the sort of level of knowledge and where are the gaps in that knowledge? And once you understand where those gaps in knowledge are, you can develop a very specific research question. Once you have your research question, you can select a design strategy. So that's how you're going to carry out your experiment to answer that question. And when you do that, you set some clear study boundaries. You then consider your ethical issues and work to collect your data or obtain the information required for your study. Once you have all the information, you analyze it and then you draw some conclusions. And then importantly, you write that up, you disseminate your work and you share it with the academic community. So we've given you an overview of the main steps involved in carrying out a piece of research. And they're shown on the left there in the red box. Now, as you work through this research methods module, each of the sessions will relate to one or more of these steps. So for example, we've got one session on critical review of existing literature and another on quantitative data analysis. Now that quantitative data analysis refers to step 6, where you're analysing information and drawing conclusions. The material in this online research methods module is structured so that we keep the quantitative and qualitative approaches separate, so you can understand and contrast those. So now that you understand the key stages of research, we'll just talk through the different approaches to research. The first is the quantitative approach, and the second is the qualitative approach. And then I'll say a few words about a mixed method approach where you combine both the qualitative and the quantitative. Quantitative methodology is the most commonly used approach. And with this approach, we assume that there's a single reality and that our job as scientists is to carry out experiments and to determine a set of rules and relationships that allows us to make predictions about what will happen in relation to health, society, and social care. So essentially what we're trying to do is to put together the pieces of a big jigsaw that explain these relationships and interconnections between different phenomena. And we do this by developing theories and then using deductive reasoning to generate specific hypotheses. We carry out experiments to test these hypotheses, and then we use that to refine our theory. So if we take the example of osteoarthritis, the big theory with osteoarthritis is that it's related to some change in the articular cartilage. Now, if that's the case, we could develop a very specific hypothesis around the idea that people with osteoarthritic pain would show a change in the thickness of their cartilage. We could use MRI scanners to look at the cartilage, and if we saw a difference between people who had osteoarthritis and those who didn't, that would confirm our hypothesis and strengthen our theory. Another key aspect of quantitative methodology is that all facts are obtained through objective observation. So what that means is that the measurement is independent of the observer or the person who takes the measurement. So if we carry out an experiment in one laboratory, we'd expect to see the same answer if we carry out exactly the same experiment in another laboratory with a completely different team of scientists. We need to reduce all of our measurements to a number or a set of numbers. And we'll talk more about that in later slides, in later sessions. We refer to that as operationalization. So that's the idea that you can take a concept and somehow quantify it. And we need to do that quantification so that we can test our hypothesis using mathematical methods referred to as statistics. Now, in quantitative methodology, there's a lot of experiments in which we control conditions very, very carefully. And we do that so that we can manipulate one variable whilst we measure the other. If we don't control things, if we vary more than one variable at the same time, we don't understand exactly what effect that particular variable is having on the other. So for example, if we're doing a randomized controlled trial and we want to test the effect of a specific medication, we need to make sure that the people in the intervention group only have this one specific medication, which is different from the control group. And there isn't a whole range of other factors which might lead to different health outcomes between the groups. So as I said before, with quantitative methodology, we use hypothesis testing to refine our theory and to create a set of theories which are consistent with each other. And what the ultimate aim really is to bring these findings together into a meaningful pattern. And we want to be able to make predictions. And we want to be able to make predictions so that we can improve health and societal well-being. Now, the last thing to say about quantitative methodology is that research proceeds sequentially. So firstly, if you think back to those 7 steps that we talked about, which characterize the research process, the researcher will always go through those sequentially. And secondly, the research itself proceeds in a linear manner, where we test our hypotheses and we continue to refine the theories as new information comes to light. So here are some examples of quantitative research. The first is an epidemiological study of type 2 diabetes. So we know that diabetes is influenced by people's lifestyle choices, such as the amount of exercise they take and their dietary intake. So we can quantify those things and relate it to the onset of this particular condition. Another one is a randomized control trial, strategies for reducing medication errors amongst nurses. Now we can actually address this question using either a quantitative or a qualitative approach. If we were to take the quantitative approach, we would test different strategies and quantify those medication errors amongst nurses which were given different strategies to reduce medication errors. The third example is what's the best design of a shoe designed to reduce in-shoe pressures. Now this is a nice example of how we might systematically vary some aspect of shoe design. And we tried to do that in a way that we varied only one aspect of the shoe design but kept everything else the same. And that would allow us to understand how this one particular aspect of the shoe, such as the shape of a particular part of the sole, how that influenced the in-shoe pressures, which we would measure with some sort of objective in-shoe pressure measurement system. The final example is how would we assess the effectiveness of group therapy to improve an individual's self-confidence. And the key here is that we'd have to use some questionnaire-based method to assess individual self-confidence. Once we had that method of quantifying this particular phenomenon, Then we could compare different approaches to group therapy to see which one was most effective. The other philosophical standpoint is the qualitative approach to research. And the key premise here is it's not possible to separate the outside world from an individual's ideas and perceptions. Qualitative researchers aim to understand phenomena in their natural environment. And the key here is to understand that the philosophy, rightly, identifies that humans have a choice about their behavior. And so we can't use this quantitative approach, which is based around creating rules to predict certain phenomena. What we need to understand instead is that individuals make specific choices, and we need to understand their motivations for making these choices, and do this in a way which doesn't necessarily force us to create rules. We need to understand people's motivation, and we need to think about these motivations not as a simple cause and effect relationship. In qualitative research, we don't start with a preconceived idea. Instead, the philosophy is simply to understand the phenomena as it is. We're committed to the participant's viewpoint. So this is best understood with an example. So if we think about people's experience of pain, the qualitative researcher would ask them about their experience, try to understand how they feel, how they experience pain. The quantitative researcher would try to quantify pain. For example, they would produce a questionnaire with different questions which quantify different aspects of pain. And you can see with the quantitative approach, we started with a preconceived idea of what pain is. Whereas with the qualitative approach, there's a much stronger commitment to the participant's view or experience of pain. With the qualitative approach, there is a belief that the inquiry should not disrupt the natural context of the phenomena. So the idea really is for the researcher to get inside the head of the subjects, to understand their world and not try to force a certain set of ideas or some framework onto them. Qualitative research is often used to generate theory. So if, for example, a new disease comes along, such as coronavirus, we can't use the quantitative approach to necessarily quantify how people experience this disease. Instead, we have to use qualitative research to explore people's experiences. Now, people will often use this type of approach to generate theory, and then they'll use the quantitative approach to test specific hypotheses that relate to that theory. So often the qualitative and the quantitative approaches can be used hand in hand. Now, the other thing to understand about qualitative research is that the steps are not necessarily sequential. So if we think back to those 7 stages that we identified as the steps of a research project, whilst the quantitative researcher will work through those in a sequential manner, the qualitative researcher may do them in a non-sequential order. Qualitative researchers don't attempt to manipulate variables. So if we think back to the quantitative approach, a lot of the time we try to hold everything the same and we try to manipulate one thing, such as medication. And when we do that, we try to understand the impact of manipulating that one variable. We just don't do that when we do qualitative research. Instead, we're trying to understand people's experiences. And we do that by using methods such as interviews, discussion groups, focus groups, to understand individual perspectives. The final thing to understand is that whilst we have a premise with quantitative research, that all measurements are carried out in a very objective way, which is independent of the observer. There is an acknowledgement with qualitative research that the researcher's perspective will have some impact on the data, and that's often recorded at the same time or reflected on when the data is reported. Similar to quantitative research, the outputs of qualitative research are reported in a structured format. So here's some examples of qualitative research projects. And I've chosen examples that are similar to the ones that I talked about for quantitative research so that you can start to understand how these two different philosophical standpoints could be used to address a similar research question. So the first is to explore the experience of person-centered care of people with chronic back pain. So we note the word experience here. So with this a qualitative approach, we would talk to these people. We would try to understand their experiences, how they felt. We certainly would not try to impose a set of ideas about what experience with chronic back pain might look like. The next example is to look at the effectiveness of group therapy to improve individual self-confidence. Now, we spoke about the quantitative approach in which we'd have to use a questionnaire to quantify individual self-confidence. Instead, with the qualitative approach, we would use a focus group or an interview or some way of trying to understand an individual's perspective on this particular group therapy. And finally, if we were trying to understand the challenges associated with frequent medication changes for older people, we would need to speak to those people. We need to explore how they felt, how they experienced those medication changes to try to understand what factors could help them better manage this. So there's now an increasing focus on combining the quantitative and qualitative approaches, and this is called mixed methods research. And what this can do is allow you to overcome the potential shortcomings of the different approaches. So we've spoken before about how quantitative research can lead to an oversimplification of individual perceptions. So for example, if we're trying to understand how people experience different types of pain, we have to use this questionnaire-based approach if we use a quantitative, whereas we can explore people's perceptions if we use the qualitative approach. Similarly, one of the shortcomings of qualitative is there's sometimes an inconsistency between different research studies, and quantitative methods can help to overcome this. So what you can do by combining both methods is to see the bigger picture, and this can sometimes be incredibly insightful when you're thinking about a particular research problem in health or social care. So there's a range of different ways of implementing mixed methods research, which typically involves a sequential approach. So you could first, for example, apply qualitative, and then you could apply a quantitative approach, or you could apply a quantitative and qualitative, or various iterations where you don't just do one and then the other, but you do them in some sort of iterative fashion. And there's more information provided on this in the interactive learning material. So now I want to say a few words about how you choose which approach you're going to work with. So the first thing, if you are interested in undertaking a piece of your own research, is to identify which particular area of health, healthcare, social care, or social policy you might be interested in. And you want to think about whether there's a specific paper that's really influenced your thinking in the field or a set of guidelines, whether there's a piece of research that you'd like to carry out that you think would lead to a very, very influential paper that could change the way people think in your particular field. The other thing to think about is how you as an individual think. Are you more of a sort of quantitative numbers person? Or do you feel that you're more inclined to want to explore people's experiences with them? And often that can be the drive for whether you decide to go for a quantitative or a qualitative piece of research? The last thing to think about is what's already known and how have people done research previously in this particular area. So if there's not much known at all, you might want to consider a quantitative piece of research, a qualitative piece of research, as we've discussed in the slides earlier. Similarly, if you're trying to understand the effect of a very specific treatment, then you're probably going to want to go down the quantitative route. So what are the characteristics of a good researcher? You first have to be open-minded. You have to think about what questions to ask, strategies to use, but you have to think about different explanations for why you're observing what you observe. You have to be very knowledgeable about a specific subject. You have to have this knowledge so that you can ask an appropriate question, that you don't duplicate what others have done before you, and that you can pose research questions in such a way so as to move knowledge forward just the right level. You have to be intellectually curious. You have to have a desire to read and develop an in-depth understanding of your field and really want to know more and to move knowledge forward. You have to have perseverance. Whilst developing research questions and reading papers can be quite interesting, the process of collecting data can often be quite laborious. So you have to have this real perseverance if you're going to succeed. And finally, you need to be honest. You must never alter your data or plagiarize work in order to get the result that you wanted. So I want to finish this lecture just by thinking a little bit about where research ideas actually come from. So the first thing is if you're a professional, if you're a healthcare professional, social care professional, or someone working in sports practice, you might have seen certain aspects to your profession that you question, certain guidelines that don't quite seem to make sense to you, or don't quite fit with the needs of the patients you see or the clients that you see. And those sort of questions in your mind might lead you into research. Another area is to think about societal trends. Think about what are the important aspects of health at the moment. So there's obviously a lot of obesity related to illness. There's a real drive from the government to increase people's participation in sport and to understand how we as a population can age in a healthy way. Those needs, those societal needs can drive research and often do at a national and international level. If you're a researcher working in the school, you'll probably want to look at the priorities of different research councils. So there's funding bodies such as the MRC, that's the Medical Research Council, or the NIHR, that's the National Institute for Health Research. And they have specific areas of research that they're keen that people apply for funding to pursue. The other place to look is in governmental organisations such as local councils. And again, they'll often have areas for research that they want people to work in to influence their policy. A lot of research just comes from reading other people's research studies and trying to understand the current knowledge and understand where the gaps and limitations are in the current knowledge base. So you can get this from reading papers. You can also get it from attending professional conferences, professional meetings. And a really important source of information are topical reviews or meta-analyses. And these papers summarize all the research evidence in one particular area and allow you to really understand where the gaps in knowledge are and what the next steps need to be to move research forward. It's also a good idea to really think about existing theory as it's articulated in textbooks or as it's sort of understood throughout your profession. And are there any sort of really unexplained phenomena that need more interest that maybe haven't received an appropriate level of research? So throughout this lecture, we've looked at a range of issues related to research and how we generate knowledge. What is research? Where does knowledge come from? And what are the different types of knowledge? We've also looked at the process of research and the philosophical underpinnings of the quantitative and the qualitative approach. We've looked at the characteristics of a good researcher, and we've also thought a little bit about where research comes from, what motivates research. Now I'm going to finish with a few example scenarios here which I'd like you to reflect on, trying to apply the knowledge that we've been through in this lecture and think how you'd use that to address these questions. So the first is around the development of a new program for low back pain in office workers. Think about how you generate knowledge in this particular scenario, whether you use a quantitative or a qualitative approach, or whether you could combine both. The next is an example from radiography, and it's related to optimal pressure required during mammography when screening for breast cancer. And the final one is from psychology. What are the effects of different roadside advertisement strategies on driver concentration? Again, how would you generate knowledge here? Would you use a quantitative or a qualitative approach?